Hi, today we're going to talk about the anatomy of the TMJ joint and how the joint functions and how we get popping and clicking. This is the normal healthy anatomy of the TMJ joint. This is the side of your lower jaw, comes to a ball at the top, and the ball fits in a socket at the base of the brain. The bone is cushioned from bone to this bone with a cartilage disc, and this is a ligament that has live nerve and blood supply, and this red over here is the muscle that helps move the jaw when you open and close. In this picture, we start to see the jawbone, the ball, start moving down and forward. It's just like when you start opening your mouth. The jaw's moving down and forward. The disc is there between the lower jawbone and the base of the skull, and everything is moving forward as the muscle pulls the jaw into its movement. Here it is where the lower jaw is completely open, as wide as possible. The ligament is stretched out. The cartilage disc is between the lower jawbone and the base of the skull. And everything is lined up perfectly like it should be. What happens is, if you have certain issues with your anatomy or with your teeth, how your teeth line up, for example, it's going to pull this apparatus out of position. And what starts happening is the cartilage disc ends up in front of the jawbone. And when you go to open, what happens is you get the pop. The jawbone moves from here, jumps over like a speed bump, jumps over the piece of cartilage, and ends up down here, and you get that pop or click. And if you're lucky, when you close, it goes back. So you have an opening click and a closing click, which is good. If you have both, honestly, neither one's really good, but if you have to have this problem, it's better that you have it's open and closes and it goes back to the original anatomy. But what happens in so many instances is that the cartilage stays forward because there isn't very much pain or discomfort with a pop or click, so people put off treatment and put off going to the doctor to get it corrected. And what happens is the cartilage permanently stays in front of the jawbone. As it moves down and forward, the cartilage is pushed forward and permanently stays there. And that's when it's much, much harder to correct the issue and resolve the popping and clicking.